Well, here's something to think about during this election campaign. Canadians consistently say their number one issue is health care, and yet we're not hearing much about it during this federal election campaign. Our medical panel is set to tackle that. Dr. Danielle Martin is Vice President, Women's College Hospital. Dr. Jay Udell is a cardiologist at the Peter Munk Cardiac Centre. Dr. Samir Sinha is a geriatrician at Mount Sinai Hospital in Toronto. And Dr. Peter Lynn is a family physician. Their thoughts in just a moment, but first, some background. Everything about healthcare is complicated, including the politics. It's administered by provincial governments, but Ottawa sets the guidelines. Among the guarantees of the Canada Health Act, universal access for Canadians. But that doesn't extend to prescription drugs. This is the only industrialized country with universal health insurance that doesn't offer drug coverage. And 1 in 10 Canadians can't afford to pay for their medications. Getting healthcare can be a challenge for many of us, from long waits at the emergency room to simply trying to find a family doctor. And even if you have one, only about 40% of Canadians say they're able to see their doctors within a couple days of calling. Compare that to Germany, New Zealand, and Switzerland, where the number's about 70%. And yet the total cost of healthcare continues to rise, estimated at more than $200 billion last year. That's about 11% of our gross domestic product, driven in part by new treatments and aging populations. Our lifestyles are adding to those costs too. A newly released study in the Canadian Journal of Public Health suggests the annual additional healthcare cost for every smoker is about $3,000. For those who are overweight, just under $1,500, and about $700 for those who are not physically active. An Ipsos Reid survey last June shows we consider the healthcare system the top issue of national concern, more than unemployment, more than taxes, more than political corruption. So why aren't we hearing more about it during this election campaign? So we have 4 doctors here who want to change that, who'd like to put healthcare on the national agenda, but particularly during this election campaign. I want to ask each of you, starting with you, Danielle, to isolate one issue that you'd like to put front and center.
Absolutely, for me, it would be national pharmacare. So we know, as we just heard, that Canada is the only country that doesn't include prescription drugs in its universal health system. We all see patients every day who cannot afford to take their medicines, who are splitting pills or skipping doses or not filling their prescriptions. And yet at the same time, we pay among the highest costs in the industrialized world for our prescription medicines because we don't have any coherent system for dealing with pharmaceuticals. So it really is up to the federal government now to be taking a leadership role on this. We've been hearing it for 50 years, and I really think that this federal election is a window of opportunity for national pharmacare. And
the problem is that widespread? You're actually, in your practice, you see people
Absolutely.
Every day?
We see it every day, and in fact, you know, you heard the 1 in 10 number, but in fact, the most recent survey suggests it's 1 in 5, and in some provinces, 1 in 4 Canadians who are not taking their prescription medicines as prescribed, specifically because of concerns about costs. So if you think about the incremental cost of the healthcare system, when people's blood pressure isn't well managed, their diabetes isn't well managed, their HIV infection, their cancer drugs that they can't afford to pay for, we're paying for all of those complications when they land in the emergency department or in the inpatient wards at much higher prices. It would be so much smarter for us to offer a universal drug program.
Every day I see someone in the hospital who's admitted because they had a decompensation of their heart disease because they weren't able to take their meds. I got a phone call today.
Yeah.
That is incredible. Samir?
Yeah, and part of the challenge is that a lot of the $200 billion we're spending on healthcare is related to an aging population. So right now, 15% of Canadians are 65 and older. The number of older Canadians is going to double in the next 20 years, and they account for half of our healthcare spending. And the challenge is when we founded Medicare across our country, the average age of a Canadian was 27. We didn't live beyond our 60s on average. And our doctors, nurses, and social workers today in school are not mandated to learn about the care of older adults. So we have a perfect storm, and this is why the Canadian Medical Association, the Nursing Association, all the major associations, including the Canadian Labour Congress, all these groups have got together to demand that we start creating a national senior strategy that focuses on issues like pharmacare, but also issues of, you know, making sure that older people don't age in poverty, making sure that we have the right health and social services available, because not only is that just better to meet the needs of an aging population, but it'll actually make our healthcare system sustainable.
And yet it feels to me like we always hear in news, it's almost a mandatory line on so many stories, Canada's aging population. As we get older, we have more various problems. What difference would a national strategy make?
Well, I mean, the problem is that right now we're very inconsistent in the way we provide care. And when you actually look at our Canada Health Act, when we created it when we were on average 27 years of age, we thought that all people needed were physician services and hospitals. We never thought about medications. We never thought about home care or long-term care. And that's actually what a lot of Canadians need now, especially as we age. So the problem is that we never actually thought about those things. We're literally being caught with our pants down. And if we don't actually get our act together, we're going to be in trouble.
Literally caught with our pants down. I'll try not to think about that, especially from a doctor. Peter, what's your priority?
I think diabetes would be a big problem with the aging population. Now over seniors, sort of over 65, about 1 in 3 people have diabetes. And the problem with diabetes is that the sugar is high in your blood, so it sticks everywhere. So it sticks inside your eye, now you have eye disease. It sticks in your kidneys, now you have kidney disease, increases heart attacks, increases strokes. So just by having sugar that's high affects all these different organs, and that's very expensive. So just on Monday, they released a study, Canadian data, that patients with diabetes compared to patients without diabetes. No diabetes, about $6,000 over 8 years. That's the cost. With diabetes, $16,000 for that same time period. So we're talking about $10,000 more for a patient with diabetes. Now you multiply that with the 3.5 million patients with diabetes in Canada, and you're up to some very large billions of dollars. And so that's why tackling diabetes would be important. And we have studies now that say if you lose the weight, if you exercise, we can take people that are teetering, almost going into diabetes, and reversing them. In other words, preventing them from becoming a patient with diabetes, therefore saving all this money.
So all of that makes complete sense. I see lots of people nodding, around the table. But how do you transform that into an election campaign plank in a platform? What's the slogan?
So it's very interesting. So prevention may be the way to go. And the problem is that people sort of think about healthcare as being a black hole. You just keep dumping money into it. So if we can show them that if you spend $1 on prevention, you can save $10 on the other end, maybe the politicians will say, this is the way we can balance our books. So let's say we could save, $2, $3, $4 billion by preventing a few patients from becoming a diabetic patient. They can now deploy that money into hospitals, into sort of seniors programs, into pharmacare, and so on and so forth. So you can actually redirect the funds if you can save some money along the way.
Jay, your issue?
So, well, just to follow up on that, so I studied health economics as part of my master's. It's not sexy to do prevention because it's not a tangible benefit that a party can take credit for today. It's going to be 10 years from now when Obama did what he did in the US. He's not going to be able to really claim the benefits of that for 10 to 20 years. And a pound wise, penny foolish, right? If you don't put in the time for investment in prevention, then we're really just a reactionary illness care system. We're not a health care preventive system. But my issue that I think hopefully is pervasive across all 3 sectors is innovation then in R&D. Our government has been cutting R&D to healthcare for the last 10 years easily. And for every 3 out of every $5 is spent on 3 sectors of the healthcare system: hospitals, drugs, and doctor bills. So we've talked about drugs. But all 3 of those systems, if we could focus on the 3 out of 5, I think if we could innovate in terms of designing electronic healthcare systems and leveraging all of our provinces to buy drugs at a cheaper cost like they do in other countries, it pays for itself.
So when you said innovate, I was thinking of machines and new techniques. You're talking about administrative changes as well, or maybe that is what you're talking about.
Sadly, in Canada, innovation might be something that other countries have done in the 1990s that we would actually finally get together and do today. There's a lot of vested interest in people not wanting for us to do these things. A lot of money to be made when there's a lot of inefficiency. There's a lot of fat that could be cut from our system, literally diabetes, and also in terms of administrative waste. And electronic digital records, if we had them across Canada, let alone across the city, and with Samir and I were talking, I can take care of a patient at Toronto General Hospital, and I wouldn't know what happened to them when they were across the street at Mount Sinai Hospital. That's unacceptable.
So 2 follow-up questions about that. First of all, why isn't that happening? Because when you guys were chatting before the camera started to roll, you both thought this is an obvious way of addressing a problem. So why isn't it happening?
My personal experience, and a lot of our colleagues, I don't think that the government is investing in the type of research that I think credits innovation. So there's been a push by, no offense, by the Conservative Party for the last 10 years has been pushing for research in healthcare and in basic science to have a commercializable end product, for there to be a business model. Because, of course, that's great. We can patent that, and there is probably scalability. And there's, I think, a place for that in healthcare. No question, absolutely. But it's a very asymmetric market, healthcare. It's a lot of asymmetric information. And so if you don't fund young people who come up with good ideas, the new investigators, then you're not getting any of those bright ideas. They've just cut the clinician scientist program nationally for federal funding. They just cut the MD PhD program for federal funding. Those are our young people. That's me. That's us.
And the innovation panel, that report that just came
Oh, yeah,
out, the
they
Dr.
buried
Naylor
that.
chair, yeah, I mean, that really said that we spend a tiny fraction of our dollars around innovation in healthcare, thinking about what are the solutions around pharmacare, around seniors. I actually got one of the last grants to actually research around seniors care, and we've actually created a website, www.nationalseniorstrategy.ca, where we're showing the evidence. But it's very hard to get grants like that actually say, here's what we should do. Here's not what's politically sexy maybe, but here's what the answer is that will actually get us to the right place.
Now, Danielle, prescription drugs are maybe a little sexier, if we want to use that word. People understand it. You know, almost all of us have prescriptions or, you know, for different things. But the costs are staggering. So this idea of a national pharmacare system presumably would send politicians scurrying.
So, you know, it's interesting because I think people find it staggering when they realize how much we are overpaying in our current system. So a year's supply of the cholesterol-lowering drug Lipitor in Canada costs probably about $800. In New Zealand, the same exact drug for a year is $15. So if you consider how much money we are essentially flushing down the toilet every year in Canada by overpaying, and whether that's governments overpaying through our public drug programs, which, you know, cover seniors, people on social assistance, et cetera, whether it's private payment through our employers-based insurance, or whether it's people paying out of pocket, that's a huge amount of money wasted. So if we were to pool the amount of public dollars that we've already got in the system, we could probably cover every Canadian, perhaps not for every single drug, but certainly for the big important ones, we could cover every single Canadian for not one penny more than we already spend. So the notion that pharmacare is too expensive is actually, it's passé. It's not based in any evidence. But to convince the federal parties to stand up and make that commitment, I think is the difficult thing. Canadians are there. Now we need our politicians to follow.
Peter?
Well, it's interesting. In Quebec, they actually did that study. They said, you know, if people take their medications and do well, what happens to the hospitalization? And so for every dollar that they spend on medication, they save $4 on hospitalization. So in other words, you could see that if people had access to their medication, their blood pressure is controlled, they don't have their heart attack, they don't have their stroke, all of a sudden that makes sense, right? So one stroke can pay for a lot of medications.
And this is not the kind of prevention that takes 20 years to show, you know, to show the economic benefits. These are, we can identify cost savings. People who have their first heart attack, they take the cocktail of cardiac meds they're supposed to take. They, you know, we immediately see the cost savings. That study's been done in the U.S.
Let me just jump in now. So we've identified these issues. All of you are nodding. No one's challenging any of the things you've said. I'm sure for people watching it just seems to make a lot of sense. The question is, and we've touched on it, how do you sell this to political parties? How do you make this a political issue? And we're going to talk about that when we're back. We are back with the National Checkup and our panel of doctors, Danielle Martin, Samir Sinha, Jay Udell, and Peter Lynn. So this is the moment where we figure out an action plan, or I guess you guys figure out an action plan to get some of these medical issues as part of maybe even this election campaign. You all see patients all the time. Peter, let me start with you. How do we do this?
Well, we got to convince the government that it doesn't cost huge amounts of money. So $1 in, $10 out, then that way they'll be interested. So for example, to get people to lose weight and to not eat so much, you're not going to do it, I'm not going to do it. I'm going to keep eating the same thing. So why don't they regulate to reduce the amount of fat in the food? So just go down by 2 or 3% every year. So that way everybody's doing it, the taste will still be the same, the companies will not be penalized, and it's easy for them to slowly reduce the fat content, the sodium content, but slowly, and also the sugar content. So over time, I'm still eating the same thing, but I'm getting less and less calories, less of the bad stuff, and I naturally will lose weight. Another thought is that the $4,000 is spent in the very first year that a person is diagnosed with diabetes. Usually they have a heart attack, and then they do a blood test, and they say they have diabetes. So maybe a screening program, you know, a national screening program day where all the pharmacies get involved, and they poke your finger, and they screen everybody to find them before they have their heart attack. And it's not paid for by the government. The drugstores would be happy to do this, and so they get high profile with very little cost going into the system.
I think somewhere there's probably someone with a drugstore who's scribbling this down.
That's good.
Right now. Samir?
Well, I think that the nice part is we formed an alliance for the National Senior Strategy. So all the major associations have gotten together, and we know that 93% of Canadians support creating this. We know that 80% of older Canadians vote. That gets politicians' attentions. And, it's very clear people want this, and the premiers have said they want this. I've met the federal minister of health. She said, I want this too. So, you know what? There's an election coming. People care about this, and we're all going to age. So I think the key is, we know the facts now. We have the data. All of us have good data behind our arguments. But I think we realize that if we don't take that action, and it really demands, I ask that all my patients talk to your politicians at the door, ask them, and we've asked all political parties. We said we just want you all to agree to make this an issue in your next, whoever becomes in power, because this is where we have to go.
And there's no magic to that, right? If people actually do take you up on your advice or your collective advice, they can actually turn this into an issue that, as you say, politicians coming to the door will listen to. Jay, what's your call to action here?
So I'm embarrassed to say that I'm typically not very interested in politics, and I have to say I sometimes think the message is the same. So when we were preparing for this, I actually went onto the website, the platforms of each three parties, to see what their discussion was about healthcare. So there's a platform for the NDP, there's a platform for the Liberals, there's nothing on their website of the PCs. So push them. I think if we're talking about it now, that's a really good first step, and we should talk about the issues. And people vote with their pocketbooks, but if we don't actually start making those investments now, I think that our generation are going to be paying for all the healthcare that we're seeing now, and then some for 3 generations.
But when you saw those two platforms for 2 of those parties, was there anything meaningful there for you? Was it platitudes?
I think it's a lot of platitudes, to be frank with you, but at least there's something. At least we can have a conversation. I'm getting the impression, and if that's the case, just say it, that it's going to be more of the same if we continue the way we're going. And in my opinion, if it's more of the same, that's going in the wrong direction. But yeah, I think it is, frankly, platitudes. But sound bites are what sells in politics right now.
Danielle, you're both a doctor who deals with patients, but also an administrator. So from that perspective, what's your advice here?
Well, look, healthcare falls under provincial jurisdiction, and we've been hearing that so often for a decade now that I think all of the parties have lost their imagination a little bit about what it is that a federal government can do to improve the health of Canadians. There is much that we've talked about tonight, and also beyond what we've talked about tonight, that the federal government can provide leadership on that has a major impact on people's health that is squarely within its federal jurisdiction. And leadership in these kinds of areas, like putting out a strategy that extends across the nation for a changing demographic, or capitalizing on our national purchasing power to get better prices on our drugs. These are things that are absolutely within the purview of the federal government. But somebody has got to stop backing away from these, on a jurisdictional basis, to say, given that this is the #1 issue of priority for Canadians, our health, we're actually going to put some skin in the game in this. And I suspect it's going to take the courage of one party leader to really come out strong on these issues. And then the rest will be forced to follow, because when Canadians hear what a vision looks like, it's going to be very hard to argue that nobody else should have a vision to respond.
And I should say, for the record, Danielle's green dress is not a partisan statement.
It's not. Although the Greens came out in favor of pharmacare.
There's a 3-way race. So they can either all play it safe, which is exactly what we've been doing in healthcare for the last 20, 30 years, or somebody can take a risk. It's going to be high risk, high reward, and I think you should take the risk.
Yeah.
Well, as we expected, lots of thoughtful analysis and actually pretty good advice in terms of a call to action. Now it's up to people to decide if they do consider this a priority. Thanks to all of you. And we'll be back with more on The National right after the break.